and welcome to this Science Saves video. I'm Gemma and I'm currently in my final year of a Physics Masters at the University of Birmingham, and I'm hoping to pursue a career in medical physics. Science Saves exists to raise the profile of healthcare science and its associated careers. There's more to healthcare than just doctors and nurses. We're releasing these interviews to help provide the information to those considering a career in healthcare science. In this video, we'll be asking a question to a number of healthcare science staff. The question for this video is, what route did you follow to get to your current role, and what opportunities are there for you to progress further?
Before starting on the Scientist Training Programme, aka the STP, I did an undergraduate in Sport and Exercise Sciences before a Masters by Research in the same department. That took me 2 years. And then after that, I worked very briefly as a cardiographer at a London trust before starting on the STP at my current location. In the future, there are lots of different potential opportunities for progression, whether that's on the Higher Specialist Scientist Training Programme, the HSST, where you become trained as a consultant clinical scientist. Obviously, this would be in cardiac for me. Alternatively, there's various other career paths, such as through academia and doing a PhD, which is certainly something I'm considering in. But realistically, for the next few years, I want to become excellent clinically before making those kind of decisions.
I currently work as a trainee clinical scientist in respiratory and sleep physiology, and to do this I applied to the Scientist Training Programme via the direct entry route after completing my degree. In terms of progression, once I'm fully qualified, it allows me to work more independently in complex investigations and also become more specialised in respiratory or sleep science. There is also opportunity for progression into more senior supervisory, managerial or research roles. For example, the Higher Specialist Scientist Training enables us to work in consultant scientist roles.
I found out about the STP while studying at the University of Manchester. I applied directly to the programme, so the direct entry route, and I had an MSc and a BSc already completed. Opportunities for your career to progress upon finishing the STP, such as for me in clinical biochemistry, I can undertake the FRC Path exams to become a Band 8 clinical scientist or a consultant.
I was a direct entry STP, so was completely brand new to the role. Before that, I had a master's in clinical neuroscience and was working for a healthcare communications agency. I got interested in ophthalmology because we were working quite closely with a small biotech who were making an intraocular lens, so that taught me a lot about eyes and vision. I knew I wanted to work in a healthcare environment rather than in an office for the rest of my life, so when I saw the STP come up, it was perfect. And now I get to develop specialist skills and knowledge, be in a patient-facing environment, and also be a part of research and innovation in a field that I'm really interested in. In terms of further progression, after qualifying as a clinical scientist and gaining a bit more work experience, there's the option to further specialise in the HSST, which is training at a more doctoral level, and the NIHR also fund fellowships and programmes for scientists who want to do research or a PhD alongside their clinical work.
I was born and grew up in Poland, and I obtained my bachelor's degree in biomedical engineering in Poland. And then I moved to London around 9 years ago to do my master's degree in the field of biomedical materials. And these are, for example, bioceramics or tissue engineering. And I was really interested in this at the time. And shortly after I graduated, I've found out about Scientist Training Programme. And I thought it's a brilliant opportunity for me to get some practical experience in a hospital, but also continue my education and get my first salary. I started my Scientist Training Programme in Newcastle upon Tyne, where I had chance to work in different areas related to clinical engineering. For example, Wiltshire's Clinic, Gate Lab. I had a chance to design my own medical software for pediatric consultant, and I was working in theatres assisting surgeons during surgery by performing spinal cord monitoring on the patients. This was really exciting, really interesting. And then I moved to Lincoln to do my specialism in the field that I was most excited about, which is management of medical devices. The NHS is a fantastic organization to work for, and it enables scientists to make a real impact on patient care. And for example, last year I got a chance to move to London to join a team of community pharmacists and work with them to develop a new diagnostic service in community pharmacy, where we were using a novel testing technology, and that's where my expertise was really useful.
The road I follow combined clinical and scientific elements. I finished a nursing degree in 2011. After 4 years working in different positions, such as hospital and nursing home, I decided to study a 4 years degree in biology. Then I studied masters in bioinformatics, and finally I applied for the STP in the specialisms clinical bioinformatics genomics. Perhaps more important than all the degrees I have studied, and what made a real difference in my CV, are the opportunities I have taken during the last 5 years. From the beginning of my biology degree, I was a student intern in a development biology labs in Spain. Then, thanks to Erasmus scholarship, I did my first years in Portugal, in which I was a student intern in a microbiology labs. Finally, I was also a student intern in the University of Cambridge in a molecular biology labs, where I did my dissertation. In Cambridge, I discovered not only the STP, but also that I was not familiar with the NHS. For that reasons, I got a job as a nurse in an A&E department while studying my master's. With my degree, but especially, I think, with the extra time I have spent in labs, I could show my commitment in clinical but also scientific context. Desirable point if you want to apply for the STP.
I'm currently a second-year trainee in the Scientist Training Programme in Reproductive Science. I completed my bachelor's degree and then went straight in to do my master's in clinical embryology, which is my chosen career path. And whilst I knew my career goal was to become a healthcare scientist, after my master's I took some time out to develop my CV, working as both a school science technician and as an optical assistant, which really helped to enhance my communication skills alongside other transferable skills by working with both people and patients. Eventually, I did start working as a healthcare scientist within the NHS in a fertility unit, and that really helped to develop both my understanding of the workings of a fertility unit, working within the NHS core values and what it is to work as a healthcare scientist, and also starting to develop my lab skills, which will be useful for the rest of my career. I started training as a clinical embryologist in 2019 via the Scientist Training Programme, which is a 3-year course to become a state registered clinical scientist. I think it's safe to say that I definitely took the scenic route to get where I am now, but I am extremely thankful for all the opportunities that I have had along the way. In terms of opportunities to progress in the future, I would say that there are absolutely plenty, whether your interests lie in management, public engagement, research or education. Working within healthcare science certainly allows both personal and professional development.
My route into the STP started in my undergrad, so I went to the University of Surrey to do a bachelor's degree in physics, and it wasn't until I started my degree that I realised that I wanted to do something in a hospital, I thought. And so I looked at my options and I discovered this thing called medical physics, which fit the bill perfectly. So in my 3rd year of my degree, when most of us students at Surrey go up and do placements, I started looking where I could go for that, and I ended up landing in an industrial placement at the Royal Surrey County Hospital in nuclear medicine, which that experience led me to realising that this really was what I wanted to do. So I had a really fantastic time at placement, learned so much, and then finished my degree, and then from there applied to the STP because I knew exactly what I wanted to do. Was fortunate enough to get onto that, and now I'm there. So in terms of progressing further, there's a course called HSST, which is a PhD equivalent that is offered. You can do it after your training, and I know some people in my trust that do, and that helps you to get onto within the NHS. Like, that's a really good way of getting on those 8A, 8B roles.
Thanks to all the healthcare staff who've participated. These interviews have shown that there's a wide range of job opportunities in healthcare science and a variety of routes to get into this field. Also, once you're working in healthcare, there are many ways to progress further and guide your career in your preferred direction. If you like this video, please subscribe to the Science Saves YouTube channel and follow us on Twitter and Facebook @SciSaves for more content like this. Thank you for watching.